So my story to medicine is a personal one. I essentially didn't want to feel very helpless. I wanted to be armed with knowledge on how to handle certain situations that afflict us, everyone in their day-to-day life. So, going through medical school helps you prepare for some of these situations. My journey into medicine was quite interesting. So when we all housemen, a bit headless and a bit clueless, when we just come out of medical school, all of us are looking for our area of interest. And it wasn't until I joined a geriatric posting in one of the public hospitals that I truly understood what holistic care really meant. Back in the day, we were going through case notes, and in geriatrics, we have to look through all the old notes, which at that time was in paper form. Okay, you had to request the notes from the medical records office, look through dossiers of files. And through reading and understanding each patient's journey, did I then get one step closer to understanding the choices that they made, the treatments they were offered, and what helped them get better, and how they are currently. So understanding and reading through their story is like reading a storybook. You get an insight into their personal life, and that helps you to understand them better, not only their condition, but also who they are as a person and why they made certain choices. So I found that in doing this, it was something that was very enlightening, and it helped me to understand more than just the illness and more than just the medical condition, but how the person was, how they interacted, who was at home with them, how they lived. And these are the things that truly makes geriatric medicine, because it's not just about medical, but it's also about functional, and it's also about physical, and how your home setting is like, and how the treatments and the decisions that we make in the hospital or in the clinic translate into real life. So knowing these stories actually helped me to make a better treatment plan for them, and also gives me great satisfaction to see my patients get better when the treatment works. So in geriatric care, we focus on care of the complex older adult, and they are typically older than 65 years of age, and they may have multiple medical conditions. And we generally see people through when they are well to when they are less mobile, maybe in their home or homebound, and also through end of life, in the last days. And at each stage of their life, we generally deal with quite a lot of conditions, and it may be things like dementia, falls, osteoporosis, confusion, mood problems, right? And it can also be due to their illnesses. Some people have heart failure, swelling of their legs, joint pains, and so on. So any elderly person can come and approach us for a review and evaluation. And if needed, we also do refer to other subspecialties. For example, when it is necessary, for example, to do a more specific assessment of the heart, we may refer you to a cardiologist. Depends on what the needs are really. In an older person's life, we go through many stages. From the period that we are well to the period where we are hospitalized, So hospitalizations are usually temporary parts of our life, and some of us may encounter that 1 or 2 times in older life, in our adult life. Usually when we are well enough to be discharged, that's not where the care ends. In fact, that's where the care continues, because we have been afflicted with illness recently. We need to make sure you're strong enough to carry on how you used to live and the quality of life that you used to enjoy. So these things are actually quite important in someone's life. So we try to help you to get back to that stage. And if you can't, then we put in services to support you. And that's where our geriatrics is different from a lot of other specialties. We work together as a team. We have a very good team. We have a nursing support. We also have our clinical support, and we also work with family medicine doctors too. So sometimes when you are much, much better, and you may not always need specialist support, we do have our family medicine doctors who can come in and help you out and see that your needs are met and there is continuity of care. And when you're not well again, so this kind of hybrid model is very useful for patients who are, intermittently unwell. However, if you have a geriatric condition, that is very difficult to handle, sometimes, for example, behavioral problems, dementia, mood problems, then that's where we may need closer follow-up. Okay? And how we look after you also depends on how you are. If you are very well and you can come to our clinic, then we're very happy to see you here. But if you feel under the weather and you need us to come to your home, we also can do that. And for us, being able to assess you, evaluate you, and also provide treatments in your home is actually very important. And sometimes this makes a lot of difference because not every elderly person necessarily wants to be in the hospital. Home is, of course, the most comfortable environment for most. But if you do need to be admitted, then, sometimes we may have that need. And terminal care or end-of-life care is also something that we do look into, especially as one ages and we reach end of life. We walk you through your last journey. We help you with your suffering. Sometimes our symptoms may be different depending on what conditions we have. For example, heart failure, breathlessness, infection. Everybody's symptoms are very unique. And so when we assess someone, we also try to target and try and help with the symptoms that can be managed with medications and also support, for example, oxygen, suctioning, and so on and so forth, to ensure that your last journey is also a comfortable one and spent in the proximity of those who you love and you care about. So in that sense, that's the level of satisfaction we hope to provide to all those that we care for. At the Straits Geriatric Centre, we hope to offer comprehensive and compassionate care to all our patients, where they will feel understood, supported, and also empowered to, lead their lives. So the beauty of having a multidisciplinary team is something that is very helpful in someone's care because our needs change as we age. The types of care that we have, we hope to be very, very holistic and be able to maintain your independence as well as quality of life. Every patient is unique, and therefore, being able to walk aside or beside our patients is very important so that we can help them to navigate the challenges of aging. I would like to think that we involve the family quite a lot in our treatment plans. It is actually quite essential to get their support in caring for an older adult because, like it says, it takes a village to raise a child. The same can be said for someone with dementia, for example. And a lot of support and a lot of cooperation is often needed. So we do spend a lot of time actually talking to the families, helping them to understand what conditions their loved ones have. And that communication process is not just educational and enlightening. Sometimes it helps them to comprehend the condition better and in that way appreciate and empathize with their loved one a little bit more. And sometimes by doing so, they may actually be more patient in carrying out their day-to-day lives and be less frustrated with some of the challenges that happen as we age. So I'd like to think our very close links with the family and our multidisciplinary, role helps very much to empower the caregivers and the people around them to feel supported. Also, the timeliness of our replies as well is actually quite important, so we are fairly accessible. So yes, do approach us if you have questions, okay? At the Straits Geriatric Centre, I think one can expect that, first of all, your needs or your concerns will be heard, okay? And only by listening to you, then we can further understand what you need. Just to give an idea of the types of services we have, we do have screening services where we screen for dementia, we screen for falls, and this is even if you do not wish to see a geriatrician yet. Okay, but at least your needs will be highlighted to you and you can bring this back to your doctor for further assessment and treatment if that's what you prefer. Our other services are also clinic-based services where we see you in person, we evaluate you, and usually once you come to clinic, you will be met by my nurse first, and she would talk to you. Should understand, how things have been at home, your medication list, and so on. And subsequently, I will be seeing you. There may be some memory tests that may be done along the way, depending on what the problem is, okay? And then we will come up with a tailored plan that suits your needs. In the home setting, where we do home services, we also do something similar. So myself, sometimes my nurse as well, we come down, and depending on what your needs are, okay, if it's the first time that you're seeing us, we would come together and we'd do an assessment. And then if you have wounds or if you have, for example, medications that need to be continued, we may do so and set a plan for you. Okay, we also offer services whereby we do IV hydration at home, we do antibiotics at home, depending on your needs. All right, we always do what is medically necessary first, depending on the condition of each patient. And in home care too, other than managing antibiotics, drips, and so on, sometimes there's a need for feeding management or nutritional care and continence care as well. And nutritional care sometimes may mean nutritional support through nasogastric tube feeding. Okay, continence care may be, for example, helping you understand how to adjust your medications to help with your bowels. It may also be things like putting in a catheter if you are unable to pass urine, or changing your catheter or tubes. Okay, so these are the types of services that we do provide, and palliative care as well when it comes to end of life. Okay, so this is where we treat the symptoms that one may face. Okay, and we try to work with the family and the caregivers. And if we do find that, support is lacking at home, then sometimes we do make recommendations and we do link you up with people who we think may help you. So depending on what the needs are, for example, we do have tie-ups with daycares. We also do have tie-ups with physios who can come to your home, okay, or even if you wish to go to a center, for example. The other things that we do are also hospital care. All right, and if you are unwell, you wish to come to the hospital, we can see you in the hospitals. So the hospitals that I currently go to are any of the private hospitals, like Glenda Parkway Group, Alvernia, Farrer Park, and so on. So these are the ones that if you are admitted and you need my help, I will go and see you while you are in the hospital, and then we will work together to try to get you home if we are able to. Okay, and see what services we may have to support you to assist you to get better. We also do preventative care. Okay, and so preventative care is part and parcel of preventing and maintaining good health. So we do exercise prescriptions. We also recommend vaccinations depending on your age group and your chronic medical conditions. So our Gleneagles location is located within the hospital campus and compound itself. However, our Toa Payoh clinic is actually in the heartlands. And as we all know, right, Singapore is aging really fast, and very soon we have a lot of people, and we're going to have a super aged society. So not everyone likes to come to hospital or clinic. So we thought we will bring our specialist services to the community and to the heartlands to serve the greater need. And that's why we have also another clinic in Toa Payoh. Although the frontage of the clinic says Straits Eye Centre, don't worry, we also go there. So I myself will go down a few times a week, and I have a very good colleague as well who works with me, Dr. Ijun. She's a primary care physician, and she's also geriatric trained, and she loves working with older people. So we actually like to do our assessments and evaluations in the heartlands at senior friendly prices, so that you can feel like your needs are met without having to come all the way to the hospital at times. And a lot of people are a bit scared of coming to a hospital because they may see, something is wrong with me. So being situated in the heartlands where everyone lives, walks, shops, eats, and that is a very kind of like a kind of like a heartland spirit lah, and to be taken care of near where you are is actually sometimes very important. So if you're coming to us for the first time, okay, just expect that you need to clear your calendar for a little while, because you might be here with us for slightly more than an hour. You know, if you've had any medical reports, to send them over and kind of pre-register. So that helps us to understand, okay, how can we address your needs? Okay, when you come, you'll be generally greeted by our front desk staff, who's very, very cheerful and very, very kind and, you know, happy. So Kavi will, you know, help you to register and settle in. After that, you know, our nurse, Celine, will help you with your vital signs, pre-assessment before seeing the doctor, and also understand if, you know, there has been changes to medications, allergies, and we may do some memory tests or some preliminary screening before seeing me. When you see me, I of course will go through some history, you know, and we will do an evaluation. I will do an examination. Depending on what your needs are, I may ask for further blood tests or even scans. But at the end of the day, we recognize that elderly patients have more than one problem. It may not be itchy skin today, it may be falls, plus, you know, memory decline, for example. Okay, so these are two very, very common problems that we see day in and out. If we do see an adult with more than one problem, we would have to prioritize. It's quite common to have a few different types of issues that we need to pay attention to, but not everything can be settled in one day at the same time. So sometimes I make a list and we'll prioritize, okay, this is the first thing that we want to do because it's the most urgent, and then we will address that first. And then once that has been settled down, then maybe we can move on to the next problem and thereafter. Sometimes if they're not too major, we can do it concurrently, all right? And we try to make the process as seamless as possible, meaning that if you were in our clinic, you know, coming for, and you're tired and things like that, at least you can have a place where everything is settled in one sitting. Your bloods can be settled in one sitting. If you want scans, we'll arrange them for another day. But at least your assessment process is smooth. And subsequently as well, once we come up with a plan for you that's unique to your needs, we may also recommend some support, additional support. For example, where to go for help if you need caregivers or if you need other resources. For example, an OT to visit your house to assess what your falls risks are in your home, okay, and any environmental modifications that may be needed. Or, for example, extra exercise. Sometimes if it's, you know, if they're quite well, I will prescribe the exercise on my own and I'll teach them what to do with a TheraBand or resistance band. But it really depends on the person. So we tailor our needs to what our patient wants and what they need. And also, if you're quite healthy and you don't have many major medical problems, then we would say, okay, let's focus on some preventative aspects. Okay, and that may mean making sure that you're up to date with your vaccinations, your cholesterol, your diabetes are all well controlled, you know, things like that. Okay? Okay, a comprehensive geriatric assessment is a tool that we use as geriatricians, just like how a gastroenterologist uses scopes to determine the problem of the patient, okay, and find out what's wrong with them. So it's basically a ton of questions that we ask you and your caregiver to find out how you're doing. Things like activities of daily living, to how your mood is, to how your sleep is. And you know, there's so many questions that we ask you, and we go into a lot of detail. Not just how come you cannot do this, but also why. Okay, is there something wrong? That's how we try to understand in greater depth how we can address any problems that we may find. Okay, and at times this comprehensive geriatric assessment is actually a very important tool, because understanding the pattern helps us to identify the gaps, and only by identifying the gaps, then we can put in the treatment for you. So we find out, okay, perhaps you're losing weight, perhaps you are becoming more constipated, then we will think, okay, is there something, do I need to check her blood count? Why is she losing weight? Is it intentional, or is there some sort of malignancy on board? So these are the things that we will flag up, and we will take a step to think and evaluate further. So this is one thing that's important. So it helps us to identify undiscovered or hidden problems that someone may have that they perhaps don't even know about. And only by doing so, we can often find the right treatment for you. And sometimes putting in things early helps them to prevent a decline in the future. I think that you should have one if you've not had one ever in the past. And if something new is happening in your life that you perhaps haven't been evaluated for, I think that's when you should come and have an assessment. In general practice, for example, how often I see a patient depends on their needs. If they have very troubling behaviors, for example, shouting or difficulty sleeping, sometimes when I adjust medications, I'd like to see them a bit sooner rather than later. And the importance of that is actually adjusting the medications promptly and making sure that they don't have side effects. Some people may find it very inconvenient to see a doctor very frequently, and that's where also hybrid kind of models come into place. Sometimes we may call, we do teleconsults and phone consults, and also find out from the family member how they are coping at home. In these ways, we actually touch base with you and find out and check in how you are going. In order for us to do so, please, bear with us. We do not mean to disrupt your work and call you so often, but it is important actually, because healthcare is life. So dementia and normal aging are not the same. As we age, sometimes we may forget things once in a while. But if we are very independent and we're able to do the day-to-day things that matter, generally we are okay. However, once it affects your lifestyle and you start to have errors a bit more frequently, that's when I think it's time to get an assessment. Actually, even before that, if you realize that the memory is starting to decline, you're not able to do things as easily as you were able to before, perhaps it might be good to have a check. There can be many things that affect memory. Okay, mood is something that can affect memory as well. Sometimes pain, sometimes events that may happen in the brain, for example, mini or silent strokes that we were not aware that they were there. And only through evaluation can we identify those things. So to someone who is a patient, it may manifest in forgetting things, misplacing things. Mood may change, behavior may change, sleep may change, and not being able to do the things that they were able to do before. If they are a very high functioning person, sometimes it may be hidden and it may not be so easily detectable. But that's where the role of the family as well comes to play, because it is actually very important for us to get corroborative history from the family members and loved ones that live with the patient, and then we can verify, okay, what is actually happening. Perhaps the patient themselves may not be very aware. Most of the time it's actually the caregiver that comes in. And so depending on what the difficulty is, maybe it's driving, or perhaps it is not being able to use the phone or iBanking nowadays, right? Now that's very common these days. So, depending on what the problem is, come and let us know and we can evaluate for you. So, early detection is always good, because once we identify the problem early, if we can start treatment early, it will benefit you earlier. And hopefully you won't deteriorate so fast. I mean, things like dementia, they are in a way neurodegenerative, okay? We cannot escape. In this day and age, there are a lot of new treatments that are available. However, whether you are eligible for it depends on many factors. And that's where we come in to assess whether you are suitable. In the later stages of dementia, some of these treatments may not be available to you. So it is always good if you seek an opinion early, and then we can see what we can do to help you and whether some of these treatments are suitable for you in the first place. There are many messages actually that I want to pass, but I think sometimes in life, more is not always more. Okay, we have to adjust ourselves depending on what the situation is at that stage. For example, if you have 20 different types of medications, doesn't mean that all of them are going to help you get better. There might be conflicts between the medications, and sometimes doses need to be adjusted, especially if there's already difficulty in swallowing. Sometimes we have to adjust ourselves and our expectations to what is happening at each phase of our life for us to be able to identify, okay, hey, that's where we are in life, and perhaps this is the priority at this stage. So sometimes being able to prioritize the issues are very important, and that's why it's important for you guys to come and have an assessment and have a chat with us. The other thing I'd like to say just in closing is we do deal with death quite a lot. We have had patients who have had a very comfortable death, and those are usually situations where we understand their preferences and what they want, and being able to respect that and provide compassionate care is so important. In each stage of our life, sometimes it's actually quite important to share these thoughts with your loved ones and explore them so that that journey in life is as smooth as we can, because sometimes there's no time for regrets. It's very important to have that communication with your patient and also with the loved ones and the family. You can reach us from our website. You can either click call, or you can send us a form, or you can WhatsApp us. We are currently located at Gleneagles Medical Centre, which is in Orchard, next to the Botanic Gardens, and I think there's a MRT right next to us, Napier Road MRT. So we're quite accessible, and we're on the 3rd floor, okay? Our other location is in Toa Payoh. It is quite near the Toa Payoh MRT station. It's at block 185. So people who live nearby in Ang Mo Kio or Bishan can also come over. So usually if you are able to, it would be good if you can book an appointment with us so that we can also give our time to you. That would be preferred. So we hope to see you soon.